Melissa Whiley loves to race, so being sidelined was tough.
Sitting still and not feeling good, it's not really my jam.
But something big put the brakes on this active 40-year-old.
Collapsed in the hotel that we were staying at. Blacked out. I don't know what happened or how long I was out.
Melissa basically had a rare type of a low-grade glioma or grade 2 glioma.
A brain tumor. And there was more bad news for Melissa and her husband, Chris.
And unfortunately, her tumor is right in that area that controls speech, her ability to pronounce words.
It was also near important areas of the brain that form memories. Neurosurgeon Dr. Kaisan Chaichana says leaving it in place could mean more problems.
That glioma could become a higher grade glioma or lead to more seizures or be catastrophic.
On the other hand, surgery to remove the tumor had the potential to compromise Melissa's speech.
It was scary. I mean, to not be able to communicate would literally be my worst nightmare.
But Dr. Chaichana had seen this type of tumor before, and he knew how to remove it without harming Melissa's ability to communicate.
He said, we're going to have to do an awake craniotomy. And my body felt like jello. And I couldn't catch my breath, really. And I was like, what?
Awake craniotomy, or awake brain surgery, seen here being done on another patient, allows a Mayo Clinic surgical team to ask questions.
Tell me what it is.
And monitor activity in the brain during the responses. This back and forth helps ensure the surgery to remove a tumor isn't affecting the patient's communication and cognition skills.
A lot of centers perform awake surgery, but we take it one step further. We rely on a multidisciplinary team to do this surgery.
It was surreal. I don't even know how to describe it.
We put her asleep for the opening part, which means making the incision and removing the bone overlying the lesion. Then we woke her up.
And you could see them all working together in surgery, and it was a well-oiled machine.
She participated in all these activities, naming objects, executive function, calculations, and memory.
The team of specialists was testing Melissa's language, problem-solving and reasoning skills, hearing, vision, and her memory to ensure they could resect the tumor area safely without compromising cognitive function.
It's just fascinating that they can avoid all of that super eloquent tissue to just get the tumor.
Thanks in part to Melissa's help, the surgery was a success.
So the scans look perfect.
Perfect?
So I don't see any
Are you
residual.
serious?
There's no residual tumor.
I will never know how you did that.
But you allowed us to help you, and now it looks good.
That is just incredible.
Just a few months later, Melissa's back at the track,
Of course I got back on that bike.
on the go and pedaling toward another goal.
It feels awesome to go. I feel amazing. I mean, awake craniotomy, totally worth it.
For the Mayo Clinic News Network, I'm Jeff Olson.